Pulmonary tuberculosis is a highly contagious bacterial infection caused by Mycobacterium tuberculosis, primarily affecting the lungs. It remains a significant global health challenge, with millions of new cases and deaths annually. Certain groups, including those with compromised immune systems or specific health conditions, are at higher risk. The pathogen, Mycobacterium tuberculosis, is an airborne, slow-growing bacillus. Its unique cell wall, composed of components like mycolic acids and lipoarabinomannan, provides extreme resistance to environmental stress and drugs. This pathogen is highly contagious via coughing, not through food or water. The infection cycle begins with the inhalation of bacilli, which are engulfed by alveolar macrophages. The bacteria survive and multiply intracellularly, eventually spreading to lymph nodes. The body responds by forming granulomas, a critical step in containing the infection through an immune response. Tuberculosis presents differently depending on the stage. Primary TB often affects children and newly infected adults, frequently remaining asymptomatic. Secondary or post-primary TB results from reactivation or reinfection, typically targeting the upper lobes of the lungs where oxygen levels favor the growth of the bacteria. Clinical manifestations of TB include systemic symptoms like fever, night sweats, and weight loss, along with localized respiratory issues such as a chronic cough and hemoptysis. Physical examination may reveal specific sounds during lung auscultation or signs of advanced disease in more severe cases. Accurate diagnosis involves various modalities. Sputum smear microscopy offers quick results, while GeneXpert tests provide high sensitivity for rapid detection. Culture tests remain a gold standard for confirmation, though they require a significantly longer turnaround time. Modern diagnostic standards utilize both molecular and traditional methods. While staining techniques like Zeal-Nielsen remain frontline tools, molecular diagnostics like cBNAAT are critical for quickly identifying TB and drug resistance. Specialized tests like IGRA also aid in assessing immune responses. Radiological imaging is vital for TB diagnosis. Chest X-rays can reveal characteristic features of primary or secondary TB, while CT scans offer higher sensitivity, clearly showing structures like tree and bud nodules, consolidation, and other markers of disease activity. Diagnostic evaluation also includes testing for latent TB, such as the tuberculin skin test and blood-based IGRA tests. These indicate exposure but do not confirm active disease. Differentiating TB from other conditions like lung cancer or pneumonia is essential for correct clinical management. The standard treatment regimen is divided into 2 phases. The intensive phase uses 4 drugs over 2 months to rapidly reduce the bacterial load. The continuation phase uses 2 drugs for 4 months to eliminate remaining bacteria and prevent relapse. The efficacy of TB treatment relies on the specific mechanisms of action of these first-line drugs. Each medication targets different bacterial processes, from blocking cell wall synthesis to halting genetic transcription, working together to systematically destroy the infection. Effective TB treatment requires careful management of drug toxicities. Medications like isoniazid, rifampin, pyrazinamide, and ethambutol can cause side effects ranging from liver issues to visual disturbances. Regular monitoring is necessary to ensure patient safety and adherence throughout the therapy. Drug-resistant TB requires a departure from standard protocols. Detection of resistance to primary drugs mandates the use of specialized, longer-term regimens tailored to the specific resistance profile, guided by drug susceptibility testing and established public health guidelines. Untreated or inadequately managed TB can lead to severe clinical complications, including massive hemoptysis, structural lung damage, and systemic dissemination. The infection can spread beyond the lungs, potentially affecting the brain, spine, and other vital organs. Global TB elimination requires a multifaceted public health strategy. This includes early clinical intervention, strict environmental controls, and community-wide defenses like contact tracing and vaccination programs. A coordinated effort is essential to stopping transmission and protecting public health.